ان احنا نقدم الاستاذ الدكتور نادر المليجي one of eminent speaker in Egypt, figure of plastic surgery. هيكلمنا ان شاء الله عن non-surgical reimplantation and revascularization of the amputated distal finger injuries. اتفضل دكتور نادر بيه.
بشكر حضرتك. نكست بتاعنا كبير. انت ليه رجعها لي 10 دقايق بقى؟ نبدأ ولا نستنى ساعتها؟ Okay. Mr. Chairman, the professors, the colleague, Egypt, 3,500 years ago, the first civilization to build special temples, the first civilization to use different colored dyes in the treatment of different diseases. The first civilization to build special temples as healing centers using light and color. I am Nader Elmelegy, professor of plastic surgery, Tanta University, Egypt. I will talk today about electrophotobiomodulation, which is a combination of intense pulsed light and radio frequency updates in the treatment of distal finger injuries. One of the dreams of plastic and vascular surgeons is to find a better treatment for difficult finger injuries. Any surgeon should think about aesthetic treatment more than just treatment and mutilating the shape of the patient. What's new in wound therapy? We are going to share with you today. Now, we are going to discuss light therapy and radio frequency in wound healing. Light therapy got many names: cold laser, soft laser, lead light therapy, low-level laser therapy, photobiomodulation. The most used name nowadays is photobiomodulation. In 2013, Michael Hamblin introduced his theory of selective photobiomodulation. He found that light is absorbed by not only by melanin and hemoglobin as known by some authors, but by all chromophores. All cell components absorb light. This is very important in the future of plastic and vascular surgery. In 2014, I started my theory about the innovation of electrophotobiomodulation. I have published a part of the work at Journal of Clinical and Experimental Dermatology, part of the work at the Annals of Plastic Surgery, part of the work at the Annals of Burn and Fire Disaster, part of the work at the BRS journal, which is most important journal in plastic surgery, and the part at the VMC. What is the difference between the theory of Mendel and my new theory? Electrophotobiomodulation by Elmelegy, we have lowered the IBL so we can deal with all types of skin, and we added radio frequency to give a more cumulative stimulatory effect. What's the meaning of electrophotobiomodulation? It is a combination of intense pulsed light and radio frequencies that can induce cell proliferation, stem cell differentiation, and enhance tissue healing. Could we use electrophotobiomodulation in different treatment of different wounds? Let us see some cases. Light stimulated fibrocytes and osteoblasts and keratinocytes to form the tissues. At the same time, light stimulated angiogenesis. What is the implication of this in the future of plastic and vascular surgery? Let us see some cases under the effect of electrophotobiomodulation. This is a case with post-traumatic finger necrosis of the skin of the finger and also multiple fractures. Some surgeons recommend amputation. However, when I use the light, stimulated light to remove the dead tissue and with very good healing within 2 months, and the patient can use his hand very well. As you can see, the macrophage removes the dead tissue, and also the keratinocytes build a new tissue, and you can see the patient is going to use his hand without any need for amputation, as you can see. Now we come to bilateral destruction of the blood supply of the thumb in one view, and most of the surgeon will ask about amputation. You can see here, this is post-electric burn, which resulted in bilateral destruction of the neurovascular bundles. They have only small bridge about half centimeters, which is used. You can see here, we have stimulated the macrophage to remove the dead tissue. I have published this work at the Journal of Burn and Clinical Research, American Journal. Using light, we stimulated macrophage and osteoclast to remove the dead tissue. And at the same time, we stimulated fibrocytes and osteoblasts and the keratinocytes to repair the tissue. You can see finger is going to gangrene. You can see here bone necrosis. And most of the surgeons recommend amputation. However, now there is removal of the necrotic tissue by the macrophage and the osteoclast. And you can see here the new bone formation. You can see here stimulation of the fibrocytes to form a new granulation tissue. Stimulation of the keratinocytes to form a very good tissue without any need for amputation, with a very good cosmetic operations. And you can see here the regaining of the bone of the thumb after bone necrosis, and how stimulation of the osteoblast can build the tissue, and the patient can use his fingers very well and very advanced. Again, ممكن الصوت أنا بلغتك الصوت يطلع بعدين. You can see here the pulsations at the proximal and distal part. The recurrence of, I don't know the mechanism, how the distal vessels regains its pulsation at both the proximal and distal part. But however, using electrophotobiomodulation, we have reached to these results. We opened a new window for plastic and vascular surgeons using electrophotobiomodulation in fingertip injuries. We will never use again cross-finger flap, which is very bad, cross-senar flap, which is very bad. What about electrophotobiomodulation in fingertip injuries? You can see here, completely avulsed part of the tip. You can see here, after 1 week of stimulation using electrophotobiomodulation, after 2 weeks, after 3 weeks with complete healing and with the nail formation, and you can see here how the child is moving his hand very well without any evidence of necrosis that occurs for the tip and with growing of the nail and the tip. You can see here complete necrosis of the distal part, and you see here after electrophotobiomodulation, the macrophage removes the dead tissue and the keratinocytes build a new tissue. And you can see here how healing was very nice and the excellent outcome and the excellent movement. And you can never see where is the scar before. Again, we have to study the effect of the electrophotobiomodulation in non-microvascular reimplanatation treatment of distal finger amputation. The failure rate in the best hands in the world in supramicrovascular is very high. However, with using electrophotobiomodulation in level C, Alan, you can see here how healing occurs in the center and how it occurs in the periphery. And you can see here how the patient is moving his hand very slowly and very nicely using only electrophotobiomodulation without any need for amputation. Again, level 4 Allen classification, you can see here how the angiogenesis occurs. First is arterial, and you can see congestion which occurs. Then you can see how healing was excellent and how recurrence of the finger to length and recur of the pulsation, as you can see. The terminal pulsation regains after total. You can see the patient uses his hand very well without any need for surgery and without any need for amputation. You can see in level 4 Allen, which is, there is no book up till now can give excellent results without any need for surgery or microvascular reimplanatation. You can see how stimulation of the light therapy and radiofrequency causes the occurrence of the arterial supply first and the delaying of the venous supply, so there is congestion, then healing. Then you can see how excellent and how repair of the tissues occurs and how the pulsations regains to all the vessels without any need for microvascular surgery for this very difficult type of reimplanatation. You can see level 5 Allen classification. You can see here how the amputation is occurred. You can see how congestion occurs as a result of osteogenesis first. Then healing was very good. Then you can see healing after complete healing. You can see even the bone grows very well and recurs without any need for anything to give. You can see here the pre and the post, the amputation of the loss of the bone and the regaining of the bone. You can see here how recurrence occur, how the pulsations. You can see also again, the pulsations is very, very good, and this is excellent results and excellent outcome. Also, you can see how he uses his hand, he uses his fingers with very good sensation and with very good outcome. You can see a more level. This is my new level, which I will do on my first report that I will come to write again. You can see here complete cut of the bilateral vascular. You can see how oxygen, how the angiogenesis causes congestion first, then the venous drainage is improved, then healing was occurred. You can see how excellent healing occurs. Excellent healing occurs. You can see how the pulsations regains, although there was a complete interruption of the blood supply. And you can see here how the patient is going to use his hand. He is going to count very freely. Even the tissues are very well held. And you can see here that from our previous work, we can conclude that electrofetal may be used as an acceptable step in the treatment of distal finger injuries. Thank you very much.